In this video demonstration, I am showing how I went about performing a phaco in a hard mature cataract. So after the incisions and staining the capsule with trypan blue, I fashioned my rhexis with a bent 26 gauge needle, targeting around a 5.5 mm rhexis. And that's pretty easily done. This is not an intumescent cataract, so no big deal in doing the rhexis. And once the rhexis is done, I then go ahead, do the hydrodissection, watch the anterior movement of the nucleus, decompress, and then give one more shot of hydrodissection. Again, watch it come forward, decompress, put in some HPMC, and I'm good to chop. Taken a pretty long sharp chopper in my left hand, and my phaco power is around 80%. My vacuum is 400 millimeters of mercury, flow rate is 40 ml, and I am going to go ahead with my woodcutter's technique of chopping, that is this direct vertical chop. And here, when you are laterally separating, you have to make sure that the crack is all the way through. That is, you have to see the red reflex, that is, you have to see the posterior capsule almost all the way through. Doesn't happen right across, but you will get it as you make more and more segments. But the primary crack should not be lamellar. And here I have rotated it 180 degrees, and that's it. That's a beautiful crack. You can do it at multi levels. And then I am now going to first divide this heminucleus into two quadrants. And I definitely will make more quadrants than just 4. You can see some of those fibers still attached, probably partly because she is a diabetic as well. This is a pretty huge nucleus, so it only makes sense to make more segments out of it. You don't want to be emulsifying large pieces. So now I am targeting these quadrants, trying to divide them further. I'm always repositing it back into the capsular bag. I do not want to take out pieces as it now. I want the capsular bag to be full. Obviously, since the nucleus is slightly mobile, you're not going to get equal sized fragments, but anything smaller will do. I have maybe one more chopping to do, but I decided let me take out a piece, and that's it. Take out 2 of them. It's almost a heminucleus done, and I have got the central attachment. It's tumbled over, doesn't matter. I've got the attachment, and once you get that attachment, central attachment, see how easy all the fragments separate, and now it becomes difficult to control them flying around. So I'm keeping a couple of them under my chopper before I release them to the phaco tip. And that's it. And the epinucleus has come out as well. There is a small bit there. I'm trying to get it out. Comes out with the irrigation itself, and there is no cortex at all. So under hydroimplantation, I inject this single piece hydrophobic lens directly into the bag, waiting for it to unfold. Once that's done, I put in my intracameral antibiotic and conclude my surgery. Thank you so much for watching.